My name is Dr. Udele Tagoe, and I'm the general gynecologist and minimally invasive gynecologic surgeon for Luca Health Medical Specialty Center. In honor of Cancer Survivors Day, I would like to say a heartfelt congratulations to all cancer survivors for making it through your journey and for your bravery. From a general gynecologist perspective, my role in terms of cancer management is more so in terms of screening. And the screening means you detect a problem before it occurs or when there's very early signs of an issue. So in terms of gynecology, obviously the relevant areas of concern would be the pelvic organs. So obviously people may be aware of cervical cancer, ovarian cancer, uterine cancer, but also cancers of the outside vaginal area, vulvar and vaginal cancer. And so when a woman may have signs of these problems, there can be obvious things in terms of pain or maybe a change in skin or even abnormal bleeding, which may occur. However, there can be no signs of these issues occurring at all. So in particular, when it comes to cervical cancer, it is caused by a virus called human papillomavirus, or abbreviated as HPV. And very early on, there may be no signs that a woman may have acquired HPV, or even that there can be any abnormal cells developing as a result of the virus being present. So that is where a routine or a yearly gynecologic visit is very important, especially in terms of cervical cancer prevention, because when a woman comes for their annual checkup, frequently a pap smear, which is a way to check the cells of the cervix for any abnormality and for the presence of the HPV virus, will be done. And it's based on those test results that one can determine, number one, is HPV present? And number two, are there abnormalities or changes in the cervical cells that are resulting from the virus being present? Now, the good news is most of the time, even if a pap smear shows any abnormality or the presence of the HPV virus, many times for healthy individuals, those changes may go away or resolve on their own. And in fact, that's what happens more than 80% of the time. But what is very necessary is for us to be aware of the fact that those changes or the virus is present, and also to do surveillance, meaning keep an eye on the cervix and keep an eye on the pap smears and do any other requisite testing that is necessary to ensure that either there is resolution of the abnormal cells in the virus, or if any additional treatment is necessary, which can be very simple and just be involving a procedure that's done in the office, to make sure that that's done to prevent the occurrence of cervical cancer. For further information, if you have any additional questions, feel free to visit Luca Health Medical Specialty Center at our website or any of our social media handles. Thank you.